about 2 years ago, Lynn brought Nappy, a little French Bulldog, to me that was in a lot of pain. It seems that 3 months prior to this, the dog had injured itself, and she panicked and took it to the regular veterinarian, and he diagnosed under MRI that the dog had a herniated disc. From my perspective, it really wasn't that serious to even consider surgery. The dog was in a lot of pain, was not paralyzed. It had some mild weakness of one of its hind legs, and typically I'm able to treat these with just a few sessions of acupuncture, and they do great. Lynn was an old client of mine. I had helped her German short-haired pointer live very well from 12, when it was declining drastically, to live past 17. But in the panic of the moment, she forgot about calling me and went to the regular vet, the neurologist, and ended up having surgery. I saw her, when I saw it was 3 months post-surgery, and the symptoms had recurred exactly the same like the first time. And this time she remembered me and said, I don't want to go through that again. I don't want to go through the surgery, the trauma, the money. Let me call Marcie. So when she came to me, yes, Nappy was in a lot of pain. He was sensitive at exactly the same spot where he had surgery, which was L3, L4. I don't need an MRI usually to diagnose where the problem is. With all my training, I'm able to just palpate and I can feel where the disc is. It was exactly at that area where he had the surgery. So although I didn't feel that this was such a serious issue, the problem now was that there was scar tissue that forms at the incision site. And once you have scar tissue, the acupuncture does not work very effectively. It doesn't pass the energy, it doesn't pass through the scar tissue. Fortunately, I have since learned another modality, which I've been using for about 8 years, which is cranial sacral work. And it is similar to acupuncture, but in my experience can work a lot deeper. And the scar tissue is not a deterrent at all from having it work very effectively. So we did about a 15-20 minute treatment of, it's like a very light kind of massage. I'm doing what acupuncture does really without the needles. It takes a lot of training to be able to do this, so don't try it. There's only about a dozen people in the world, a dozen or 2 dozen, that know how to do this particular technique, and I don't advise people to do it without having had training. And even with training, it's best that a professional does it. But it's very, very gentle. The dogs relax. Even though a lot of dogs relax with needles, and it's said they like acupuncture, they do like this a lot better.
And what really, upsets me is that I didn't come to you first. But the vet at the animal hospital presented this as an acute situation that required that required immediate action.
Right.
Like, we had to get him to this special hospital, and we had to have surgery ASAP because that was the only treatment that they knew.
And if you didn't do this, you were a bad dog.
Right. Oh, totally. They kind of terrorized us, I would say. They made it like, you have to decide now. We're going to put him under for the MRI, and we can't bring him out and let you decide what you want to do, because French Bulldogs, don't do well with anesthesia. So if we put him out, then, and if it's a surgical, case, we're going to go straight to surgery, and you don't have any time to think about this or say, well, yes or no, or what are my options?
So did you feel intimidated by them?
Totally,
Yeah.
totally. I mean, they didn't really explain it except like, if this is surgery, you have to do the surgery now, and if you don't do the surgery in the next 2 or 3 days, the paralysis will become permanent, and your dog will never walk again, whatever. So I felt really pressured into making this decision, and I knew that Frenchie's had problems with, being anesthetized, so I didn't want to risk that, losing him, bringing him out.
And he wasn't paralyzed at that point.
No, he was walking, but his leg was definitely dragging behind him. He was turning his foot under, and
it was mild.
Yeah. So anyway, they came out from the MRI and said, oh yeah, he's blown a disc.
Yeah.
This is surgery. And they said, and oh, by the way, this is $8,000, right? And we don't take any insurance, not that we had any at that time anyway. And mostly they were worried about payment. Like, how are you going to pay for this? Like, there were all these papers to fill out,
like a regular human hospital.
Show us your credit card, show us your bank accounts, It was all about the money, rather than actually, caring for the dog. So he finally came out of the anesthesia, And then he stayed there for 2 days, and they showed me the MRI of his back.
Yeah.
And they said that he had spinal degeneration from his neck to
all the way down.
All the way down.
All the way down.
All the way down. You know, it wasn't just this one thing that had happened one time. You know, that this could happen
Again.
Like again,
So
again,
even though
and
you just
again.
spent $8,000 and all of this,
They weren't offering, you know, so I said, well, what do we do?
Right.
And it was like, well, you know, you really have to be careful with him. You can't let him jump. You can't let him, you know, play. You've got to, you know, really, you know, like keep his activity level to a minimum. But they didn't offer me like anything like, you know, acupuncture or massage or any supplements or anything like that would help with not just the healing process, but with the ongoing, you know, maintenance, right? That we would need to do, you know. So
how did he do after surgery?
He did well, and we took him back, I think, because he had sutures and he had to have. Oh no, he had these. Oh my gosh, I have pictures. You know, they shaved his back and and it was stapled together, right? So he healed well,
right?
And then they took out the staples and sent us home and said, "See you soon." It's like, see you the next time, you know, one of his, you know.
So that was 2 years ago.
Yeah, it was.
I'm
like
just looking at my record, so it's almost 2 years that I've seen you. So what happened was several months afterwards, he went out again, his back went out again.
Well, you know, it was just like we could see that he was in pain again.
So that was about,
you know,
5 months after the surgery.
Yeah. So, and all of a sudden I just went, ding dong, I need to call Marcie Fallek. What have I been doing? Taking him to the regular vet, you know, where all they do is, you know, load him up on vaccines. Nobody's talking about, you know, like maintenance for his back overall health or anything like that. It was just like, we'll wait till the next disc blows up so we can do more surgery. Right?
Well, what happened was, just like they predicted, another disc, what happened was there was another disc that blew.
Yeah.
And thank goodness you came to me first this time instead of the regular vet, because it was a completely different area. And as I look at my records, I think it took us just 2 treatments, and that was under control again.
Yeah.
And now it's 2 months, and he's really just a little bit sensitive. No big deal. No, 2 months since his last treatment.
The last treatment.
And he's really doing great.
Right.
No need for surgery.
No, certainly not. If I said, oh, I'm going to go to my holistic vet and see what, you know, if we can do some acupuncture, you know, they would have just like, you know, pulled his chart and shredded it. But only if all my bills were paid. So anyway, even though he had the surgery, he came through the surgery fine.
Yeah.
He had a good surgical result, according to them, right? Okay, what I realized is that he has a chronic condition.
Right.
It's not just an acute, once in a lifetime thing that he hurt his back. He's got back issues that are going to last now.
Which they showed on the MRI, the whole back was all.
Yeah, but they had no treatment for any of that. It was just like, wait until the next one happens and we'll have more surgery.
Right.
And I was never going to do that again. So, and then I guess what really upset me about myself is that I've known you for years, and I love you, and I believe in you. And why I didn't come here first, I still don't know why. I just got into that panic mode, like, oh, I have to go to, you know, the vet, the animal hospital, we have to do surgery, right? And now I realize that what we did, yes, it got him over
Thank God, because it doesn't always work that well.
But no, I mean, they told me, like, you know, he could die, or he could come out and be, you know, crippled and lamed and paralyzed. But there were no guarantees, Marcie. The only guarantee was that they were going to get my $8,000. But there were no guarantees that my dog was going to live through the surgery, that he was ever going to walk again, that this was any kind of cure for anything. It was just like all about the money, and, you know, here's your dog. And they were very pleased that he had a good surgical result. But I realized, you know, that this is an ongoing issue with him. And, you know, yes, we needed to modify his activities, and we've tried to do that because he's really a tough guy.
But he's lived since I've seen you the past couple years, his normal life.
Yeah, pretty much. I mean, we don't throw the ball as far and high, and, you know, we carry him up and down the stairs and stuff like that. But there was no, like, long-term care for him. Like, there was no program.
But thankfully for him, we were able to
unblock the blockage
and
of the
then
scar
but
tissue.
see, this is where I want to kick myself.
Yeah.
Is when you told me, I said, oh, but he had such a good surgical result. And he went, yeah, but now you really screwed it up for me because acupuncture is all about having a nerve.
Energy flow.
Energy flow, right? And so when you do surgery, right, you've cut the nerves, right, and you've created scar tissue. So I want to get the energy flowing, but when it gets down to that surgical point, right, then the energy is going to stop there. And I won't be able to help him as much as I could have if you had come to me first.
Right.
And I'm going, spank me, because I was like so mad, so angry with myself, right? So that's when we started coming on a more regular basis. And, he has his ups and downs, but mostly there's been, steady, improvement. And the only thing that we really still have to think about is has he, he's just so active. He does not want to sit
know he
down.
doesn't feel the pain.
No. So we just have to really watch it and make sure that we don't, get sucked into throwing the ball and, letting him run around like a crazy man, So that's when you talked to me about cranial sacral, because you said, look, acupuncture is the way I normally treat, right? And that's the way you treated my dog before. And we've gotten very good results. And you said, but in this case, acupuncture is not going to be, 100%. So we need to look for another, modality, right? Okay, to work with him. And that's when you talked to me about cranial sacral. So when I come, what we do here, we usually do a little bit of acupuncture, right? And then we do more cranial sacral. And he feels great. Right? Great. And the other thing is that he loves coming here. He just, from the time we get up to your gate, he wants to get out of the car. He wants to come in here. Even if your dogs are here and they're barking, that's okay, right? He wants to come in here. He loves this room. He will go to sleep on the floor. He'll sleep on the table. He's not stressed at all. He's so calm when he comes here. I think because just the whole energy here is so different. When he would go to the regular vet, he would, from the time we turned the corner to park the car, he was shaking and trembling and cowering and not wanting to get out of the car. And we would take him in and we'd be in the waiting room, and usually we'd be alone. So there was no real reason for him to be stressed out. He was totally stressed out. And he would sit and he would hug me and oh, don't let them touch me, And it got to be so bad that they couldn't even put him in a treatment room because he was so, tense and stressed. Whatever had to be done, if he was getting a vaccine, they would just bring it out in the waiting room, jab him in the butt, and we go. So there was not ever a bad experience that he had there. There was no real reason for him to be so nervous about the vet. He hated going there, and I hated taking him there. So there must have been, I told you it was also a boarding kennel in the back. So there were always a lot of other dogs barking or whatever. But whatever smell or sound or whatever energy he was picking up on, right, it just was awful taking him
So
to
it's just
the
a
vet.
relief being able to...
Yeah, we come here, he's happy to
happy.
see you. He, today he's running around, but normally he just plunks himself down here. And I'm not going to say that he loves the acupuncture 100%. There are some needles that he seems to flinch. But once we've got him all porcupined up, and you're doing the electrostim on him, he usually just relaxes and he's fine. And then you do your cranial sacral magic, right? And when we leave, you always tell me he'll probably be tired for the rest of the day. And he goes home and he has a big nap. It's just really been, a miracle working with you again.
Thank you.
And I know my other
you.
dog, you gave her an extra 4 or 5 good years.
I know.
Not just years.
I know. But you
years.
don't know how many people don't. This is my biggest lament. I see people when their dogs are old and dying, they get a new puppy and they start all over again with a regular vet.
Right. It's a commitment, I think, to work with a holistic vet. Definitely more involved.
Take responsibility because we're a team.
Yeah.
We have
And
to
that's
be
what
a team.
it is.
A teamwork.
That's what it is.
Yeah.
And when I see him, when we come in here, sometimes he's had, too much activity. Sometimes he's jumped off, the rear deck of the house and, banged up his back. So, but when we come in, we always get these incredible results. I mean, the acupuncture and the cranial sacral seem to work almost immediately. Like he's going to be, like right away.
Yeah.
So it's not like I have to bring him every day, week after week after week. It's usually 1 or 2 or 3 treatments.
Yeah.
And as long as we're careful with him and we keep his weight down and his activities down, then he's just, he's on a maintenance program with you that they would not provide for me or for him at the normal vet. So that's why I'm here. I just think that it takes a kind of a leap of faith, but when you get here and you see the results that you get, and that the whole procedure is non-traumatic, and that it's an ongoing plan, that there's no reason, to think that this is not as good. In fact, this is better. This is better than going to your vet.
I mean, would you say it's never the best way? Would you say, can you think of a case that going holistic first would be?
No, I guess if I mean, you agree that there are some cases where you go to the vet.
Like broken leg.
Yeah, a broken leg. If you have a broken bone, if I have a broken bone, I'm going to the emergency room. I'm going to get a cast, stuff like that.
It's always good in Dad and Melissa's life-threatening emergency to call the holistic vet first, because actually the avulsion I could have helped you with, the back thing, it is a crisis, and you do think you have to do something immediately.
Right.
But it is best always to think of holistic first, not as the last resort, but as the first choice.
And that's
and then the holistic vet can tell you, I think that this is a surgical procedure. I think you need to go to regular vet.
And that's the way I think the whole thing needs to be flipped.
Flipped, exactly.
Like this is first. But see, that's what is good about you, because you have that experience of both sides. You were traditionally trained.
So I understand where they're coming.
You were a vet for a long time, right? And then you realized that there were better ways.
Well, this is the sad thing. I mean, I understand where they're coming from, but they don't really understand what we're doing.
Right. And also, I remember you would go to London
8 times a year.
8 times a year, right? To learn more.
For 15 years.
About that practice. I was in awe. Like you must really believe in this. It's a whole science, and a very respected science, a very ancient science. So homeopathy is what we all ought to be doing for ourselves and for our animals, not just, when you have, this, emergency, this, crisis situation. That should be on everybody's plate. Like the 1-a-day vitamin, so you should have your homeopathy. Well, I've definitely sworn off of regular vets. It's a big racket between the vets and the dog food industry people. Like you don't really stand a chance. And if you tell them like, oh, I'm going to go see my holistic vet, they look at you like, okay, then, we can't help you anymore because, you're doing something that's so out of pattern, and, it's ridiculous that they make you feel very fearful about leaving their form of treatment and trying anything else. So, but in my experience, they haven't done a whole lot. And every time I come here with you, and we get, incredible results. But anyway, I can't thank you enough. Nappy loves being your
we
client.
love having you. You brighten our day.
Yes, he loves coming here.
I'm hoping he's never going to ever have to even consider another surgery ever again. So he's 8 years old now. He's great. He's running around, and we do try to restrict his exercise. We don't want to have him jumping around playing Frisbee anymore. But he's living a normal, happy life in the country, chasing squirrels, and he's doing great. So I'm very optimistic for his prognosis.
No one else should touch me except Marcie.